Assalamu alaikum, students.
عليكم السلام ورحمة الله.
وعليكم السلام دكتور.
Okay, as you know, on Thursday we have the practical examination, right? So anatomy is part of it. So in that anatomy, as you know, it will be related to anatomy of male and female reproductive system. So this lecture we have already covered. This is just the revision so that you can recall all the information which you had read, so that it can help you in the practical examination. Okay, so this lecture is just to help you for the practical examination. You have already seen the models and some information related to that. Okay, as you know, the anatomy of the male and reproductive system. So first we'll cover the male reproductive system and then we'll go to the female reproductive system. As you know, the components of the male reproductive system, the primary organ of male reproduction will be the testis, and in case of female, it will be the ovaries. Okay, so these are called as the primary sex organ. Okay. And then we have the reproductive tract. What do you mean by reproductive tract? The tract which will carry the sperms in case of male to the right place where it has to go. Okay, so it will be carried by the epididymis. This is the epididymis. Then we have the vas deferens and the spermatic cord, within which this vas deferens is one of the content. Later here, if you see here, this is called as the spermatic cord, and one of the structure, there are many structures within the spermatic cord, and one of the structure will be coming from the testis, that is the vas deferens. Okay, so this will be the reproductive tract through which the sperms are carried. Then we have something called as accessory sex glands. Accessory means additional, extra. The primary sex organ will be the testis. The additional will be the prostate, which is the largest of the accessory glands. Then we have the seminal vesicles and bulbourethral gland. Okay, so here you can see here, this is the prostate. Then we have the seminal vesicles. These are called as the seminal vesicles. Just behind the bladder, they will be present. This is the seminal. This is the cut section of the same seminal vesicle. Then we have small glands here. These are called as the bulbourethral glands, also called as the Cowper's gland. These are the bulbourethral glands. These are called as the accessory sex glands. Then we have the external genitalia, which is the copulatory organ that is called as the penis. The primary organ, as you know, is the testis. So here you can see this is the testis. If you see, they are in pairs because it is on the both the right side and left side. So they are in pair. Okay. Then it is almond shape or oval shape. This is the testis here, which is oval. As you can see here, it is almost oval in shape. Okay. And gonads. Gonad means this testis and the ovaries together, they are called as gonad. It is called as, this testis is called as the male gonad and the ovary is called as the female gonad. So gonad means a common term for the primary sex organs that are suspended within the scrotum. These testes are suspended within a skinny bag. This is called as the scrotum, and it is suspended from above by, this is the spermatic cord, as we are talking, spermatic cord, and one of the content will be the vas deferens, and here you can see the testicular artery, veins, everything. Okay. Coming to the volume of the testis, it is almost, it can hold up to 20 to 25 ml of the production, that is mainly the sperms. And the length of this, because it is oval in shape, the length will be this one, and it is almost 4 to 5 centimeters long, and the breadth is just 1 to 2 centimeters. And the weight is almost from 10 to 14 grams, 10 to 15 grams. Okay, that is the weight of the each testis. Function, as you know, the testis, the main function will be the spermatogenesis. That is the production of sperms is called as spermatogenesis. Along with that, it can also it also produces the hormone, the male hormone, that is called as the testosterone, androgen, called as the testosterone, that is the male hormone. So it helps in testis, does two functions. One is the spermatogenesis, the second is production of the male hormone testosterone. Now coming to the scrotum. Scrotum, as I said before, it is a cutaneous bag or skinny bag. Cutaneous means skin. Okay, scrotum is a cutaneous pouch. It is a bag or pouch of loose skin. As you can see here, the loose skin and superficial fascia. Deep to that, there will be the superficial fascia, which contains or houses the testes and parts of the spermatic cord. So it will, as you can see here, they are in pair, the testes are in pair. So they will be housing the testes. They will keep the testes within these bags. Okay, and also a part of the spermatic cord. Here you can see that it is spermatic cord, and if you cut it open, this is how you can see here. Inside you can see these are nothing but the pampaniform plexus. Pampaniform plexus. There will be artery, pampaniform plexus, vast difference, everything within this spermatic cord. The scrotum is divided into two. Okay, so if you can see here, it is divided into two parts by a median raphe. Inside we have a raphe, ridge or raphe, which will divide it into two pouches, which will house the two testes on either side, two lateral pouches, which will house the testes, and in between is the raphe or ridge, which separate the two bags. Okay, the left scrotum, if you see here, it is always lower than the right. If you see here, the right will be slightly higher. This is the right one here, slightly higher, and the left will be slightly lower. This is always the position of the right and the left testis. Left testis is always slightly below, lower than the right testis. Coming to the functions of the scrotum, one is it houses the testes as well as also protects the testes by the skin and the superficial fascia. The second is the most important function, which is the regulation of the testicular temperature. As you know, for spermatogenesis to take place, the testis has to maintain a temperature which is slightly below 4 to 5 degrees below the normal body temperature. Okay, so if it cannot do that if it is inside the body, because the body temperature is slightly higher, and the testis needs slightly lower temperature to for the production of the spermatogenesis. So this bag will keep the testis outside the body and it regulates the temperature. If the body is hot, it will the testis will the scrotum itself will come down, and the testis will be from far from the body, and it lowers the temperature. And if the outside body temperature is lower, then it will pull the testis upwards towards the body, so that it increases the temperature of the testis. So this is how it regulates. Regulates means increase and decrease, or which maintains the temperature needed for the spermatogenesis. So that is called as regulation of the testicular temperature. This is the main function of the scrotum. And second is it houses as well as protects the testis. Now, if you see the internal structure of the testis, as we know, the whole of the testis is covered by a fibrous capsule from outside. So this is the whole capsule, and from the capsule there will be septa which are going inside. These are called as septa. Okay, which will divide the whole of testis into 200 to 300 lobules. If you see here, between the two septa, this is the septum here, coming from the fibrous capsule going towards the rete testis. These are the septa, which will divide the whole of the testis into 200 to 300 lobules. This is one lobule, this is one lobule. Okay, between the two septa, this is called as lobule. So there are 200 to 300 lobules, and approximately 250 an average. And each lobule will contain 1 to 3 seminiferous tubules. So each lobule will contain 1 to 3 seminiferous tubules. So how many seminiferous tubules in total in each testis? If there are 250 lobules and each will have around 3, it will be almost 750 seminiferous tubules will be there. Okay, you can take an average of 2, and it will be around 500 seminiferous tubule in each testis. And each seminiferous tubule, this is the seminiferous tubule, is a very long tube, almost 60 centimeters long. Even though it is 60 centimeters long, but it is put in a very small cavity because it becomes spiral and it can be put into this lobule. Okay, it is 60 centimeters long tubule, and these are the sites of spermatogenesis. This seminiferous tubules, as you know, you might have studied already the histology part, where you see the sections of the the seminiferous tubules, and you can see the different stages of the spermatogenesis. So these seminiferous tubules are the site of spermatogenesis. In between the seminiferous tubules lie the interstitial cells of Leydig. In between these seminiferous tubules, there are small cells. These are called as interstitial cells, or they are also called as the interstitial cells of Leydig. Leydig is the scientist who found it. So, and the main function of these interstitial cells of Leydig will be the production of the male hormone called as the testosterone. So, very important. So, these interstitial cells of Leydig will secrete the testosterone. Then we have something called as retate testis here. This is the retate testis. Sperms travel through the testis from the tubule through a network of ducts called as the retate testis. So all these seminiferous tubules come here and they form a network. Means they form a connection between each other and they form a network here, and the sperms which are produced in this seminiferous tubule will travel through the retate testis called a retestostele to the epidermis, and from here they pass through the efferent ductules into the, this is the epidermis. So structure is called as the epidermis. Now coming to the blood supply of the testis, it is supplied by the testicular artery. The artery of the testis will be the testicular artery. Okay, and the vein is called as the testicular vein. Artery is testicular artery, vein is the testicular vein. Okay, the testicular artery will be direct branch from the abdominal aorta. You can see here on either side, right and left, it is common from the abdominal aorta. But the venous drainage is by the testicular vein, and they have some differences. So they begin as a plexus around the testis. This is called as the pampaniform plexus of veins, pampaniform plexus, and they drain on the right side. It will drain into the inferior vena cava. IVC means inferior vena cava. On the right side, it drains into the inferior vena cava, and on the left side, it drains into the left renal vein. So this is the kidney. So the vein draining the kidney is called as renal vein. Renal means kidney. So on the left side, it drains into the left renal. On the right side, into the inferior vena cava. On the left side, it is into the left renal vein. Okay, this is the difference on the right and left side in case of the veins. The arteries are same. Both are from the abdominal aorta. But the venous drainage on right and left, it is different. And this is why it is important, because clinically it is important, because the left testis is these veins here, they have valves, so they lose their competency, and there is something called as varicocele. Clinically, when you go to the clinical side, at that time you see that the varicocele of the left testis is more common compared to the right, because it has to drain the vein, the blood against gravity at 90 degree. Here it is directly, it can drain into the inferior vena cava because it is oblique. But here it has to go like this and then flow against the gravity like this. So it is more common on the left side. That is called a varicocele, a clinical condition. So that's why the venous drainage of right and left side is important. Coming to the lymphatic drainage is by the testicular lymphatics. Okay, and they end in something called a lumbar or para-aortic group of lymph nodes. Around this aorta, there are group of lymph nodes, and they will be draining into the para-aortic group of lymph nodes. Okay, and the scrotum, penis, and pubis will be draining into the superficial inguinal group of lymph nodes. Superficial inguinal group of lymph nodes. Coming to the epidermis, as you can see here, so this is the septas, and this is the lobule within which we can see the seminiferous tubules coiled, and they all drain into the retate testis, and from retate testis, they are drained, the sperms are drained through the front ductules into this structure called as the epidermis. So epidermis is nothing but a single coiled tube. As you can see here, initially it looks like it is multi, but it is a single coiled tube, highly coiled tube, just like seminiferous tubules are coiled. Here, retate testis, from retate testis, what you see, this is the single tube which you will coil, and this from the epidermis. So it is almost 6 meters long, very long tube, but still this is also kept in a very small area because it is highly coiled. Located on the superior and posterior margin of the testis. So this is the testis here. It is present on the superior, means on the top, as posterior means behind the testis and above the testis. So this is the location of the epidermis. And it has three parts called as the head, body and tail. Upper part is called as the head, which is larger part. Then we have the body, and the last part is called as the tail. And the tail will continue as the vas deferens. As the vas deferens. Here is the vas deferens, or it is also called as the ductus deferens. Both are same. So the head, body, and tail. The head receives the retracted testes, efferent ductules from the testes. As you can see here, the head is receiving efferent ductules, and the tail will continue as the vas deferens. This is the vas deferens or ductus deferens. What are the functions of the epidermis? It will secrete and absorb the nourishing fluid. So it will secrete the nourishing fluid which is necessary for the sperms. When the sperms come here, they have to stay alive. So that will be the nourishing fluid will be provided by the epidermis. Second, it recycles the damaged spermatozoa. It will remove all the dead and damaged spermatozoa which are incapable of fertilizing. The third, it stores the spermatozoa up to 2 weeks. Why? To allow for physiological maturation of the sperms. Even though the sperms are produced in the testes, their maturation will take place in the epidermis. So they will stay here, the sperms will stay here for almost 2 weeks for, for maturation of these sperms. Then after this, once the testis has produced the sperm, they entered into the epidermis, they are mature here for 2 weeks, then they are pushed to a duct called as the vas deferens. So this is the vas deferens, or it is also called as the ductus deferens. It is a muscular tube almost 45 centimeter long, very long tube, which is coming starting from the tail of the epidermis, goes all the way back into the abdomen. Okay. So, around 45 centimeters long tube, muscular tube, carries sperms from the epidermis from here to the pelvic cavity. This is the pelvis. This region is called as pelvis. So it will carry the sperms back into the pelvis, passes through the inguinal canal. There is a structure here called as the inguinal canal tubes. Okay, that we will study later as one of the content of the spermatic cord. As you can see, you have seen one of the content of the spermatic cord. It joins the duct of the seminal vesicle. If you see here, once it comes here, goes behind this is the bladder, urinary bladder. So it goes behind the urinary bladder, and this is the ureter. And from here, if you see here, it joins with the duct of the seminal vesicles. So vas deferens and the duct of seminal vesicles. So it joins the duct of the seminal vesicle to form the ejaculatory duct. So now it is called as one duct called as ejaculatory duct. Seminal vesicle, this is the seminal vesicle and vas deferens joined together to form the ejaculatory duct, which opens into the prostatic urethra. So this is the prostate here. It passes through the prostate and opens into the urethra. This is the urine bladder. This is the ureter, and this is called a urethra, which will drain the urine outside. So this ejaculatory duct now opens into there are different parts of the urethra. In case of male, this is called as the prostatic urethra. The part of the urethra passes through the prostate. So it opens into the prostatic urethra. And now the sperms will flow through the urethra. Okay. So this is called as the penile urethra. Okay. So urethra in case of male does two functions. One is passage of the urine and also the ejaculatory fluid. Okay. Now coming to the accessory glands. As you know, there are three accessory glands. One is the seminal vesicle, prostate, and the bulbourethral or the Cooper's gland. As we have already seen, these are the seminal vesicles here, and here is the prostate, and there are small glands here. These are called as the bulbourethral gland, very small glands. Okay, among these, the prostate is the largest of the accessory glands, and the functions of this accessory glands is one is secretion of the seminal fluid. The main content will be coming from the seminal vesicle, so it is called as seminal fluid, and this it helps in the nourishing and activation of the sperms. This seminal fluid produced by all these three, contributed by all the three accessory gland, but mainly by the seminal vesicles. Okay, and it helps in the nourishing and as well as activation of the sperms. So it helps in providing the nutrition required for the sperm and the development of the sperm. Then it also helps in the protection of the sperms because they will be floating within this fluid, so it also helps in the protection of the sperms. Now coming to the largest of the accessory gland, that is the prostate. So as you can see here, this is the prostate, this is the urinary bladder here. Same thing here, what you are seeing. This is the urinary bladder and below is the prostate. So here is the urinary bladder and this is the prostate. So this is the largest male accessory gland. It is fibromuscular glandular tissue. This is a fibromuscular glandular tissue. Uh, um, you will understand more about this fibro, what do you mean the fibromuscular glandular tissue later when you go further. So right now, just know that it is a fibromuscular glandular tissue. The size almost the size of a walnuts. Okay, and it is located at the neck of the bladder. This is the bladder. The neck of the bladder is below. Neck means usually it should be above, but here it is below. So it is at the neck of the bladder. This is the neck of the bladder, and the prostate is just below that. Traversed by the prostatic urethra. From the neck of the bladder, we see the passage of the urethra. So this passing through the prostate, so it is called as this is the prostatic urethra, and this is called as the membranous urethra. Okay, so this is the prostatic urethra passing through the prostate. Secretes 20 to 30% of the seminal vesicle. Even though this is the largest, prostate is the largest male accessory gland, additional gland, but it secretes only 20 to 30% of the seminal fluid. And if you see, it looks like a cone shape. This is the cone shape structure called as the prostate. What are the functions of the prostate gland? As we have seen, it will be one of the structures which will be secreting the enzymes which are necessary. Okay, and this enzyme which is secreted to the prostate will help in activating the sperm motility. So the enzymes necessary for the activation of this sperm motility for movement. Second is it mucus degradation, means it will remove the mucus. Mucus is not necessary for the seminal fluid, so all the mucus is removed by the prostate. And also it helps in secreting a fluid which neutralizes the acidity of the female reproductive tract. If this is not secreted, then the sperms will go into the female reproductive tract, which is alkaline, and it will die. The sperms will die. So it helps in the neutralizing. It will secrete the fluid, which will neutralize the acidity of the female reproductive tract. Okay, so the prostatic secretion will be alkaline fluid. Now coming to the last part of the male organs, that is the external organ, that is the penis. This is the penis, that is the copulatory as well as the excretory organ. Okay, so the excretion is by the penile urethra, as you saw the urethra. This is the cut section. You take a section, so you can see here. This is the three important structures which are present here. There are three cylindrical masses of erectile tissue which help in erection of the sperm of the penis. There are two corpora cavernosa. These are called as the corpora cavernosa. Cavernosa means spaces. Okay, where the blood will come and make it help in erection. Then we have the corpus spongiosum, within which we can see this is the spongy urethra. Urethra is present in the spongy corpus spongiosum. Okay. Coming to the female reproductive organs, so if you take a section at this level, this is the pelvis, and here you can see the female reproductive organ. This is the uterus, and this is the vagina. These are the fallopian tubes, and here are the ovaries on either side. So as you know, the components of the female reproductive system are again divided into internal and external. The internal organs are present within the true pelvis. This is called as the true pelvis. Okay, so what are those? One is the vagina. So vagina is a bit below. This is the cervix, and this is the uterus. And then we have the uterine tubes, also called as the fallopian tubes, or they are also called as the oviduct. And finally, the main primary organ, that is the ovaries. Then we have the external genitalia, which will be outside. This is present in the outside the true pelvis, like the perineum, mons pubis, clitoris, labia majora and minora, greater vestibule, periurethral area, everything which you will study in the later stages. Okay. Now coming to the The main primary organ, just like in case of male, it is the testis. In case of female, it will be the ovaries. Here are the ovaries. So it looks very similar to that of the testis, and almond shape, oval shape, and the size is also similar, almost 4 centimeters in length and 2 centimeters in breadth. But this is present in the pelvis. In case of the testis, it is present outside the body in the scrotum, but in case of female, the ovaries are present within the pelvis. Pelvis is below the abdomen. Okay, and a depression called as the ovarian fossa. There is a fossa called as the ovarian fossa within which these ovaries are present. The function, it will help in the production of the female germ cells, that is the oogenesis. In case of male, it is the spermatogenesis. In case of female, it is the oogenesis, and also secretion of the female sex hormone, the female sex hormone. Okay, so that is the estrogen and the progesterone, which will be produced by the ovaries. Now coming to the some more details, it is attached to the back of the broad ligament by the peritoneal fold. There is a peritoneal, this is the peritoneal fold, and this is called as the broad ligament. This is called as the broad ligament. So it is present on either side, and it is held by meso-ovarian. This is called a meso-ovarian. Coming to the arterial supply, just like in case of male, it is the testicular artery. In case of the female, it is the ovarian artery coming from the abdominal artery. Very similar to that of the male testis. Here it is the ovarian artery. Coming to the venous drainage, this is also similar to that of male. So in case of male, it will be testicular veins. Here in case of female, it will be ovarian vein. Ovarian vein on the right side drains into the inferior vena cava, but on the left side drains into the left renal vein. As you can see here, it is draining into the left renal vein. Very similar to that of the testicular vein also. Testicular vein also drains similar to this. Okay. Coming to the lymphatic drainage, it is similar to that of the testis again, para-aortic group of lymph nodes. So if you know the testis, you know the ovary. If you know the ovary, you know the testis. Nerve supply is also similar, derived from the aortic plexus. Now coming to a very important structure called as the uterine tubes, or also called as the fallopian tubes, also called as the oviduct. So as you can see here, on either side we have the oviduct here. Okay, it is almost 10 centimeters long and enclosed by the upper border of the broad ligament. As I said, this is the broad ligament. So the upper part of the broad ligament is with the presence of the fallopian tubes on either side. Okay, so it has 4 parts. This is called as the infundibulum. Then we have the largest part called as the ampullary part, where the fertilization takes place. Then we have the isthmus. Isthmus means narrow, but this is not the narrowest part, because the most narrow part will be the intramural part, which is within here, very short. But intramural means inside the muscle. As you know, the uterus has a thick muscle, and that part will be called as the intramural. If you see here, this is the intramural part. So this is the narrowest part. Even though isthmus means narrow, but the most narrow part will be the intramural part. And the fertilization will be taking place in the isthmus. This is a very important part, because fertilization takes place here. The site of fertilization, as I said, will be ampulla. And what is the function of the fallopian tube? It will help in the transportation of the ovum, as well as the sperm also into the uterus. Okay. Coming to the uterus, as you know, this is the very important organ, that is where the fetus will actually start growing. Okay, so it is a hollow pear-shaped muscular organ. It is a thick muscular organ which has the capacity to expand. In case of young and nullipara means those ladies who did have not become pregnant till now. So those are called as nulliparas. In case of nulliparas who are not pregnant, who had never had pregnancy, and there it will, the size of the uterus is very small, just 3 inches into 2 inches into 1 inch, 3 inches in length, 2 inches in breadth, and 1 inch in thickness. But once there will be fertilization and the implantation takes place here, then the uterus has the capacity to expand to a very large extent. This is a pelvic organ, as I said. all the female reproductive organs are pelvic organs, but this will start becoming larger and larger, and it occupies almost the whole of the abdomen, almost the whole of the abdomen. So this organ has the capacity to expand to a very large extent. Okay. Now this uterus is divided into three parts. The fundus is the top part above the opening of the fallopian tubes. On either side, the fallopian tubes are opening. So above that part, whatever is this is called as the fundus of the uterus. The remaining part is called as body, and the lowermost part, this is called as the cervix. So there are three parts: the fundus, body, and the cervix. And the usual position of the uterus is anteverted anteflex. Very important. Remember, is anteverted anteflex. This is the position. This is called as anteverted and anteflex. What do you mean the anteverted? The long axis of the whole uterus is bent forward on the long axis of the vagina. If you see here, so anteverted. So this is the long axis of the cervix, and this is the long axis of the vagina. So it is almost 90 degree. This is called as anteversion. Then anteflexion means long axis of the body of the uterus is bent on the long axis of the cervix. So the cervix and the body is not in the same angle. So if you see here, this is the angle of the body, and this is the long angle of the cervix. It is almost more than 90 degree, and this is called as anteflexion. So these two angles together, it is called as anteversion, anteflexion. Okay. So this is the position, normal position of the uterus. This is very important. Normal position. If it changes its position, then it leads to a lot of complications. Okay. One of them, as I said before, it will be the infertility. Now coming to the blood supply of the uterus. So this is the blood supply is supplied by the uterine artery. See, here is the uterine artery. This is the uterine artery coming. So this is the uterine artery, and it becomes very tortuous. It gives two branches above and below, both the sides, right and left. There are two arteries supply the whole of the uterus. Venous drainage is by the pampaniform plexus. You see here there is plexus of vein, lot of veins coming together. They all drain into the uterine vein. So this is the uterine vein, and this is plexus. This is called as pampaniform plexus. Same like in case of the male, there is pampaniform plexus around the testes. Here in case of the uterus also, there is pampaniform plexus. Coming to the cervix and vagina. So the lowermost part here is the cervix, and this is called as the vagina. The cervical canal, so the cavity inside the cervix is called as the cervical canal, inside this cavity. Cervical, this is the uterine canal. So this is the uterine cavity, and this is the cervical canal. So it communicates with the cavity of the body through the internal os. So it communicates into the body of the uterus through this opening is called as the internal os, and with the vagina through the external os. So this is called as this opening outside is called as the external os. So in between the internal os and the external os is the whole of the cervix. So internal os opens into the uterine cavity, external os opens into the vagina. So as you know, the vagina is a fibromuscular tube. It is also a copulatory organ coming extend from the external os to the open outside into the vulva. This is called as the outside. The female external genitalia is called as the vulva. So it opens into the vulva from the. So this vagina is from the external os to the vulva. Function, coming to the function, as I said before, it is a copulatory organ, as well as it also helps in, it acts as a birth canal. So it serves two functions. One is copulation, and the second is the acts as a birth canal. Finally, coming to the uterine ligaments and cervical ligaments, which will hold the uterus in its position. One is the broad ligament. As you can see, this is the broad ligament. This is the peritoneal fold, which is called as the broad ligament. If you can see here, this whole thing is called as the blue colored structure is called as the broad ligament. Then we have the round ligament. Okay, if you see it here, if you hear it is clear. So this is called as the round ligament of the uterus. And then we have the ovarian ligament. Ovarian ligament. You see here, this on either side. This is the ovarian ligament. So there are three ligaments: broad ligament, round ligament, and ovarian ligament. These are the three ligaments you should remember. Later you'll study more, but right now you should remember these three. So this is all about this lecture, and this is just a revision because your exams are practical examination is on Thursday, and it will be mainly related to the male and female reproductive system. So if you have any doubts, you can ask me.